go.
So good afternoon. I think it is important that we report to the nation the status of COVID and flu, particularly as we all try to enjoy a safe and wonderful Christmas season. The information reaching us from the epidemiology unit shows that we still have some challenges with respect to respiratory disease and COVID in Barbados. The positivity rate is just below 20%, and the R effective is above 1. And those two metrics together indicate that we are still having COVID spread in our communities. In addition, what we also know is that the number of persons coming to be tested has fallen off, and therefore the number of persons having COVID within our communities is maybe not a true reflection of what it really is. And therefore I ask that you be cautious around the Christmas period. On the good side is that the hospitalization rate has remained low, and of those few individuals who were hospitalized, they are having milder forms of illness. We unfortunately, within the last 7 days, have had a single death, and we continue to monitor hospitalizations and death as a metrics to determine how severe infections are. So we will continue to work with the population. Many of you know what are the preventative measures. I'm not here to dampen your Christmas in any way, but we are here to let you know that there are still simple things that you can do to prevent sickness and illness. We are indeed facing a double whammy because we have COVID circulating and we also have flu circulating. The flu virus has been typed. It is H3N2 that has been circulating, and that has also increased steeply within the last 2 months. We continue to monitor both for flu and for COVID. The flu virus, fortunately, we have not had any hospitalizations or deaths associated with the flu virus, but we continue to examine the information and will report to you, the public, with respect to if there are any changes in that trajectory. But it is important to know that flu is, in some countries, flu does cause significant sickness and even death. So the good thing is that there are similar ways to prevent COVID as you can prevent flu. Therefore, I will ask Ronald to speak a bit about the prevention methods that individuals can use, particularly concentrating on the most vulnerable in our society.
Thank you, Dr. George. What I would want to say is that as international travel ramps up around this time of the year, it is extremely important that we pay attention to our preventative measures. Things like mask wearing, which is still probably the best, if not the best method of preventing the spread of respiratory illness. They continue to ensure that your hand hygiene is up to scratch. If you are not able to wash your hands, still use your hand sanitizers. The whole idea of physical distancing and so on, those things are still important. However, we recognize that there has been a relaxation in the directives, and because of that relaxation, we are expecting persons to take, well, in that relaxation, we expect persons to take responsibility for themselves. So we are asking persons, as we continue to work through the issues of COVID, if you are feeling unwell, you're feeling ill, it is wise to put on a mask. You may not have COVID, you may be suffering with the flu or maybe just a common cold, but all respiratory diseases can be fought with the use of the mask. So it is still a measure that can be used extensively to fight COVID and other respiratory disease as we work through this period of winter. Well, the winter season, I should say. What we are also asking persons is to monitor themselves if they are should I say manage their risk, they manage their own risk. If they're feeling as though they would put themselves or a member of the family at risk, it would be mindful to ensure that you wear your own mask and so on. Now, the Ministry of Health has no intention at this present time to return to the heavy-handed approach that we had during COVID. As you can see that with the relaxation of the protocols and also with the dissolution of the COVID-19 monitoring unit. So we are at a place where we believe that persons can act responsibly, that persons can take stock of their own risk, and they can look and see how they can protect themselves, as opposed to having persons police every movement that they made. And that was important during that period of time because we knew very little about the disease, and we had a lot of hospitalizations, and we were dealing with highly infectious strains at that point in time. But now we have a better handle on it, and it is time that we get to return to some sense of normalcy. Now, what I would also say is that, as I said, we have no intention of returning to that approach, and we would want persons to pay attention as we go forward. Dr. George, anything else you would want to say?
No. So thanks, Ronald. What I would say is that we have learned so much over the last 2 years, and I think that gives the Ministry of Health the confidence with moving forward, and we would appreciate the public's continued support. The viruses circulating are certainly not as deadly or causing severe illness as when we were in the throes of Delta. The virus circulating is very infectious, so the likelihood of transmission is high, but the outcomes appear to be a bit better. But we still know that the following categories of persons are considered to be vulnerable: those who have chronic diseases, those who are overweight, those who are advancing in age, and those are the persons who we will ask to go the extra mile. The message is personal responsibility. We will continue to work with you every step of the way. Let me assure the public that the ministry has not taken its eye off of COVID. We don't come to the public as often as before, but we continue to run the EOC and have several systems in place in the background to make sure that the national response continues. Thank you so much.
There's one other thing I want to just mention. There's one other thing I want to mention is that the wearing of masks at this present point in time, the wearing of masks is still mandatory in a number of institutions, especially in those areas which Dr. George spoke of, where persons are we consider high risk. It is still necessary for the wearing of masks on public transport, in schools, in geriatric hospitals and old people's home, and in the QEH. We recognize that the risk associated in areas such as these where there are lots of people together, it is important that we continue to manage ourselves, to take personal responsibility, and to be our brother's keeper. So at this point in time, I would just like to thank you and to wish everyone a very Merry Christmas.